Good evening, everyone. My name is Dr. Okobi. Again, we're going to have these roundtable scientific sessions on structuring ourselves as physicians, either foreign trained or US trained, on how to become better physicians working in the US. One of the ways to improve or to get better in one of the ways to, to get to serve the population here in the US is first to get into a residency. Now, today we're going to tackle a lot of conversation on what steps do you need? How do you optimize your residency application, which is an area where many foreign trained physicians are usually a little bit lagging, I'll use the word, but many of them are catching up. The aim of these conversations is to eventually make you well positioned, get used to the culture, make you well positioned to become a good applicant to get into residency. Today we have a guest speaker who is an oncologist in training. He's actually a brother of mine, same father, same mother, someone who I've watched him. We all grew up together, someone who, I'm very proud of. He's a fellow in heme oncology. He's going to introduce himself better. He's going to be talking about optimizing your application. We've been having series of optimizing our application, and we're going to continue having this series of optimizing your application until, we get as many people to be comfortable in their flesh or comfortable doing these things personally and then coming back to give back to the community. Dr. Tobechukwu Okobi, welcome to our program.
Yeah, thank you so much for having me. Thank you for that introduction as well. Very excited to be here to have this conversation and kind of just to give back to a community that I've been a part of for several years now. Again, my name is Tobeo Kobe. I'm not an unfamiliar face to the group. I'm currently in fellowship um, going into my last year of fellowship, training to be an oncologist and a hematologist. So kind of have some, background and some experience, having gone through the residency process and gone through fellowship as, the fellowship application process as well. And then really just again excited to be giving the talk. So we'll dive into it and it'll be in two halves. Um, I'm hoping to have it a bit interactive. So maybe just for the first part, kind of just going through major concepts that I think we should all be aware of. And like Dr. Ed alluded to, we've touched upon this during multiple meetings. We touched upon different aspects, but these are ongoing conversations because, as you continue to hear and learn about them and hear from different, people based off on their experiences, it shapes, your own perspective and it kind of improves on what you already have. So that first part is going to be just going through some of the major things that I think we should be aware of. And again, we've spoken about some of them, but we'll kind of go over them again. And then the second part will be the interactive part where we'll take questions, and just kind of hear our thoughts. Um, the cycle starts obviously, you know, as soon as possible. There's obviously timelines that have been set for when the application cycle opens, when you should start filling out your ERAS, when you should, submit your application. So there's obviously timelines, and I think that's kind of the first place to start from, identifying, the timelines that have been set, so that you kind of will know how best to work around those timelines. So if you have to get, your steps in, if you have to get your certifications in, if you have to begin to, whatever it is that you kind of have to do, you want to know how much time that you've got to do those. So timelines are very, 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 very crucial. And you want to be realistic with timelines too. How much can I achieve within the timelines that have been set and the timelines that I've got. So there's obviously the timelines that have been set officially, but there are timelines that you have for yourself too, based off on where you're at per time. So timelines are important. Now, while once you get that figured out, I think with the ERAS itself, the ERAS is a system that has been put in place to kind of um, put your entire application all in one place. So when your ERAS gets sent over to the program and they look at the program, it's really a snapshot of your entire narrative, different aspects of your narrative, your letters of recommendation, where you've worked, your personal statements, what you're interested in applying to, all of that stuff, in my opinion, is a snapshot of your story that the program gets. Obviously, the interview is also another aspect, another snapshot as well. Multiple snapshots that they kind of use to, form an impression about you. The ultimate goal really is, can I have this person as my resident? And what does that truly mean? It means, can I work with this person? Does this person understand the essence of what this entire process entails? And if the person finally ends up in my program, would I be would I without a doubt know that I've made the right choice picking this candidate? Keep in mind,
Right.
these programs have tons of applications coming their way. So, being filtered out of that, application pool as the candidate that they're picking, and, obviously everybody wants to make the right choice there. So, um, so again, your ERAS is a snapshot, and I think working on the different parts of the ERAS is kind of what I want to touch on today. Probably not going into specifics, but highlighting what I consider the crucial, and everything is crucial, to be honest. What I think what I want us to do, if we don't take out anything from this conversation, is take out the fact that if you take a step back and look at your ERAS, it should have told one beautiful, put together story. Your personal statements, your letters of recommend, everything should put together a story that will become your theme. What's the theme that I'm trying to portray? I'm trying to portray somebody with a lot of experience, with diversity, somebody who's tenacious, somebody who's just willing to learn and work, somebody who's, you know, done everything to get to this point, and is very excited about what the next steps are. So kind of find a way to mentally.
Let me stop you there a little bit. Let's see
Well,
if we can dig deeper
yeah,
on that, framing your application to have a team, because it's something
yeah.
that many applicants, people just just shoot in application, and there's this concept that we teach in this group, in this forum, that your application should have a team, something that the programs are going to look and remember you for. How is that possible?
So I think it starts off from you as the applicant and what theme you want to portray. Once you have that idea in your head, it's easy to kind of tell the story from different angles. So if you're telling your story from your work experience, because that's how the ERAS, I think it's evolved over time to highlight, I can't remember the exact terms, but more like important parts of a job that you've done or something like that. There's certain, phrases that they use to describe how you should present your work experiences. And it's a lot different from how it was when I applied for residency, which could be a good and a bad thing. But I think what they're trying to do, this is my personal opinion, and there's no right or wrong answer here. Different people have their thoughts, but I think what they're trying to do is have you be able to highlight yourself in a certain theme. So let's say, for example, I wanted to highlight myself as, again, somebody who has a very diverse background, somebody who's very, hardworking, somebody who's project oriented and result oriented. Then, when I'm highlighting some of those things that I've done, I could highlight that I did my internship at, ABCD University in Nigeria. And then the experiences that I'm highlighting at that internship will ultimately be geared towards demonstrating those strengths that I want to demonstrate. Because there are tons of experiences you had at ABCD University, right? But,
Right.
with the recurrent theme that you have in your mind that you're trying to portray, it kind of shapings the experiences that you want to highlight.
Right. I'll throw in. I know this is unexpected question. I'll give you a typical example, three or four examples of common themes, and then let's see how we can guide people around this. Like for example, someone who's passionate about underserved care could be a team that you could, what I mean, a team. So it's going to be resonating in so many aspects of your resume that when the program director sees it, the program director will be like, oh, wow, this person is passionate about underserved. It could be someone passionate about research if you're applying to a research dominated or a research heavy, subspecialty or a research heavy program. It could be someone passionate about women's health, for example. I know, like, for example, in my program director is particularly drawn towards people who are passionate towards women health. And I've also heard people who marched into a residency program in family medicine because somewhere in their resume they highlighted their achievements and their passion and their vision and their mission around women's health. There are people who are also passionate about rural medicine program. For example, if you're applying to rural medicine, and then you tailor your application towards rural medicine, right? So you talk about what you've done in rural medicine before, how you improved patient care, how you improve communication, how you reduce disease burden in a rural setting. So these are like common themes that, that's coming off my head. There are also, people who are passionate about mental health. For example, if you're applying into psychiatry, then your passion towards mental health should resonate strongly in your resume, in various aspects of your resume. Your personal statement, you're going to be talking about how you've created solutions or you're about to create solutions or you're thinking of creating a common solution that affects people with mental health disorder, right? And same thing with the wordings that you use to describe your 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 the characteristics of what you've done in the past in your resume. I don't know, Dr. Tobifam, if this makes sense.
I 100% agree. And in line with that, I think keep in mind that while you're trying to match into an institution, the institution is trying to find it's trying to make sure that you're a good fit for them. And what does when we say this concept of good fit, what does it really mean? It means, do I have the resources to train you based off on your needs, if you have any, right? And that's really what Dr. Ed is referencing, right? Maybe they've just maybe the program director is very passionate about maternal health, and that's what you've highlighted as a theme for yourself, somebody who's very interested in all of that. You'd find this program very interested in taking you as a resident because they know that they have the resource to support that interest, right?
Right,
If you're applying to a community program and you've referenced, somebody who's very big on rural health and whatnot, a community program will be very excited to have you because they know they have the resources to support that interest. Same thing to an academic institution or a research-based institution, So I think it's important, and it's okay if you don't have a niche that you're interested in, but I think it makes you stand out a little bit to some degree because there's always going to be a program who will find you interesting. And we've heard this multiple times where the program says, this is why I thought you were interesting, because I saw this about you and I thought it was interesting, or because I know you have this interest, or because of this, or because of that. And a lot of times for us, as foreign applicants, we don't even realize this until when the situation comes up and like, oh, okay, thank you. I highlighted that because it was something I had done, right? A lot of the local trained folks applying internally already build their pathway telling a particular story. So everything they do kind of lines up nicely so that when they turn in that application, you've already, kind of worked in that direction that you're headed, if that makes sense. So
right,
yes, I totally agree, Dr. Ed.
right. And somebody may ask, why does team matter? Like, Dr. Kobe said, you may not necessarily have a team, but it's something we really strongly advocate everyone to have because we think from experience, having, I use the word mentored over 1,000 people, both of us in this journey into residency. We think, there's a lot of applicants. People have similar score. People have similar backgrounds. These program directors are reviewing people who have similar score, similar background, similar years of graduation, similar, almost everything in medicine. We all have like everything similar, right? So something must stand out in your application, something that will make you more memorable, something that will make it more consistent, something that will give you more purpose than other people. That way, Or okay, let's say for example that they are reviewing Dr. R. Dr. R has 260, and Dr. P that has 260. Dr. R graduated from Yale, Dr. P graduated from Yale. Something else that resonates with them. Somebody may also ask, okay, what if I randomly choose something and that's not what the program is interested in? That's where we begin to tell people to start program research early. By now, you should have been building your program list so that you begin to look deeply into this program to see what are they actually looking for. I know Dr. Toby agrees with me about discouraging random application. I don't know if you want to talk about that or why we pivot away from team.
Yeah, I mean there are many. So theme is one, and just kind of shifting gears to you know the institutions you want to end up and how you kind of will build that pool. So there are many things that influence being able to build that pool, but I think a big one is finding institutions that you connect to. Let's assume that you have everything going for you. Your scores are stellar. Your 2 years postgrad or even 1 year. You have tons of research. So you have like the ideal, perfect candidate CV or ERAS application, I would say. Um, you still want to you have the luxury of applying to as many institutions as possible, but you want to tailor your application to uh, what you want. Is it from a geographical perspective? I've got family in Texas or in Maryland, so I want to look around those institutions first. Or let's even not go too far. Let's start from yourself. Let's say you're in the country and you're living in New York. Obviously looking in and around the programs in New York, because that becomes a tie for you. I live in New York. It only makes sense that you'll be interested in New York, right? So could it be, and you don't have to be interested in New York, by the way. I'm just using that as one tie. Is it a geographic tie that you've got? Is it a family ties, right? Is it colleagues from your medical school who are currently working in an institution? So that's where looking at those institutions and kind of finding best ways to identify if they've got the resources that you that will work for you, and I know if they have what you need, and kind of identifying what they need to see if you could tailor your application to that. So I'm not sure if I'm answering your question like that, but I
Yes,
think
yes, you are. You are absolutely because it's something that we see almost all the time. People in September, October just randomly selecting programs and just applying. And it really hurts them. Sometimes I feel it hurts them even more than their score hurts them. This might be anecdotal, but it really, really hurts them. People enter the application season with fear, without strategy, without knowing what to apply, where to apply. Yes, absolutely. You're doing justice to it. Go ahead.
yeah, no, I obviously there's lots of implications to applying to multiple programs, including financial implications as well. I remember when I first applied, I did apply to tons of programs as well, but ultimately the programs that will call you for a reason. And in hindsight is 2020, but I saw that connection. I saw the reasons why they were calling me. Something will stand out that is a connection. So I think connections truly, truly, truly matter. And your first, however, whatever number of applications should be very intentional, should be a connection between you and those programs one way or the other. It just really helps to tell a beautiful story.
Let's break down that word connection. When they say connection, in what specifics will a typical applicant like this be? What specific will a typical applicant consider to be connection to a program?
So it's a vague term that people use in multiple ways, but there are many ways to look at it, right? And we'll use real examples or hypothetical examples, I would say. Um, Jay is a resident at University of A, and University of A is in New York, and I'm currently applying for residency. And Jay was my classmate in medical school. That's a connection, that's a tie that you have to that program. And, tons of people get invites from such connections. Because at the end of the day, I don't want to take a robot for a job, right? I want to take somebody who's reliable. And there are many ways I can know that you're reliable. One of them is knowing somebody that you know who can speak for you or can say, I think this person is reliable. Another way is knowing that somebody who's coming from your background, has done very well at my program. So I have no doubts, even though you're two different people. But I can assume that if you're sharing the same background, you're almost likely going to do. And people say this all the time. People coming from Nigeria, it would typically generally have positive comments. People say Nigerians are very hardworking and they do very well, as trainees here and even as attendees at the end of the day. So that can be a connection. A connection could also be, you have an interest in fetal maternal health, for example, and this program has a very robust fetal maternal health program. They have, renowned experts in fetal maternal health, so they have all it takes to support that interest, which is something you want to look out for and see if those programs have those unique things that you like, and if you highlight your passion to be trained by these mentors, it obviously raises strikes the bell. They want to see, okay, let's even talk to this person and see why fetal maternal health and what are the strengths that this person will bring to our program to help us grow this niche that we have.
Right.
So there are there are zillions of ways to think about connections, but
Right. I think another way to think about connection is like I think you've mentioned that in the beginning, connection in terms of geographical connection, the state where you live. Most programs may want to take you because you live in New York. The New York programs may want to also favor your application, bring your application up the ladder a little bit because you live there. And it's one of the reasons why we tell people to apply to, regional programs, state local programs, programs around where you live. Dr. Toby, what do you think about that?
yeah, no, it makes sense, except that, they obviously people who are applying from abroad, and the question will be, okay, but I don't live here. How do I now make those ties? Um, you know, let's if you don't have those ties, you don't have those ties, right? There are other ways that you can strengthen your application, and it's not again not a weakness. Obviously not. Ties are excellent, are great. If you don't have them, you don't have them. I recently went for a job interview, and they asked me, why this place, and I made it quite a fun answer. I said, to be honest, I don't have ties here, if that's what you're asking. But what I do know is that I want to change or move on from where I'm currently at to kind of, move in this direction because I'm looking for A, B, C, D, and E, which I know that you have, something like that. So, I think ultimately you still want to be human. If you're applying from abroad and you don't have those geographic ties for whatever reason, you don't have somebody in the program that you can connect to, which could be a geographic tie for you if you kind of think of it. I know somebody, so you're telling the program director, I know Dr. J, who's currently your second year resident. He went to my med school. We're very good friends. He's told me a lot about your program. I was really very excited to apply it to your program. And I'm very excited about the prospects of training there. That could be a geographic tie if you think of it. But if you don't have it, you don't have it. And it's okay to be honest. Why New York? It's a very diverse place. I don't really have any personal ties to New York per se, but I know that, from all the things I've heard and all the things that I've read, it's a very diverse city. I would not have to look too far to find my people. It kind of relates or reflects the society that I'm coming from in terms of diversity. So I know I will thrive and do very well here in New York, something like that.
Something somebody told me, many of us were born into this world without having connection. And that's why you guys are listening to this talk, so that you can also you build the past. No, it was a mentor of mine that told me this. You see, at every point in life, try to build your past by developing your future. That's what he said. So now that you know that this thing matters, how do I now build connection moving forward? Because we've mentioned academic connection, we've mentioned geographic connection, we've mentioned cultural connections, and there are so many other types of connections, like, if you have done research there or whatever. I think there's a way to also position your future so that when you look back, you can now say, now I have connection, because many of you sitting here right now may not have that ties connection to as many programs that you want. So things like rotating in the program, reaching out to the program, right? Attending conferences where you're going to identify these programs, and then you now create ties with them. That way you are positioning your future. So when you look back by August, you say, oh, wow, now I have connections, in quotes, what they mean by networking to these programs. I don't know, Dr. T, what do you think about that? Building your
I
future so that when you look back, you could, because none of us was born knowing each other. We all intentionally formed this group. We all intentionally are creating the future that we want to live in, so that when we look back, we could say we did it.
Yes, there's some relationships that you're born into. A lot of the other relationships you make, you form, and I think with residency, the application process is one that a lot of the relationships and the networks and the connections you want to form, and you want to be intentional about it, and you want to be genuine about it. And I think something I find exciting now is that we're shifting into the era where people are getting comfortable with you know, people reaching out and relationships and networks and whatnot. In my opinion, again, personal opinion, is no right or wrong answer. I think it's gotten better over the last few years. I think it was a lot harder to reach out to people before than it is now. Maybe thanks to the social media era, you know. But I think it's gotten much better. And in line with that, again, I kind of will pivot towards using social media and leveraging it off as a tool to enhance your relationships and your networks and your if you're not in whether or not you're in the US, if you're back home or you're abroad, obviously you want to leverage your social media. I found it very useful. And I think, a few things I would say there is, if you don't have one, I think it will be okay to have one, at least one of these professional, platforms, where you put up a professional, image of yourself. Your picture is professional, your name is professional, your bio is professional, and the things that you're posting there, the institutions that you're following, the people that you're following are professional, and they could form as basis for, the relationship moving forward. Say for example, you're following Dr. X, and one time you get to meet Dr. X in an interview. You say, hey, Dr. X, I'm very excited to meet you via Zoom. I've actually been following your posts for a little while now, and I find them very engaging, very interactive. Like, one of your posts from a few months ago talked about diversity and whatnot, and it was something I could really connect to. So I'm very excited to be interacting with you today. Something like that. So yeah, I think
One,
again,
one
you're born into relationships, but you make
You
relationships.
create relationship. One of the things I also want to, because we're online, we're probably going to go viral soon. About it's some people equate connection to favoritism or corruption, or something negative, right? Whatever, however you want to term it. But something I usually say, that positioning yourself professionally is not favoritism. Making yourself visible. We're not talking about, you know it's good to clarify that we're not talking about favoritism connection. We're talking about, making yourself professionally visible, professionally known to a program, right? Dr. B, you might want to clarify that a little bit.
Yeah, no, I don't. Anybody who thinks connection is, favor equals to favoritism, I think is misunderstanding the concept. Um, you know, I want to let my work speak for myself, and be able to, like Dr. in your words, Dr. Ed, put that work in front of the audience that I need to see it. Because I could do all this amazing stuff, but you know, nobody really sees it. So being able to highlight what you're doing, being able to let the right audience, acknowledge what you're doing, creates opportunities for you. And I think that's really what we're talking about here.
Yeah, just in wrapping, because we want to like convert this second section to question and answer and then interactions. Just in wrapping, I think, and then you tell me what you think. I also think programs like it when they know that you are consciously making efforts to understand their culture, to reach out deeply to them, attend their events if possible, without spamming them. There's, harassing program. We're not talking about harassing programs. When you show authentic interests in your journey, in your professionalism, and also in your experience in leading people into fellowships and residency, what would you say? What do you think? How do you think programs perceive people who are intentionally, trying to reach out to build genuine interest and connection to understand how they function?
No, I totally agree. I think a lot of programs want to know that you have some semblance of understanding of, what they do, right? The audience, the population that they serve, the needs of the population. And of course, you won't know everything in terms of the nitty-gritties because you're not there. But, just having some idea gives me a sense that what you're talking about and what you're up for, what you're signing up for. I know you have a very diverse, now you're speaking to a program, I know you have a very diverse patient population, and it resonates a lot with me because every health system that I found myself has been one with diversity, not just with patient, not just with colleagues, not just with the community, but even the patients themselves, even the pathology that we're seeing. So diversity is an environment that I thrive in, and I am very comfortable knowing that that's the environment that you, again, the institution is at, and I'm happy, something like that. Um, so knowing a bit of the program is, I think is crucial.
Yeah, well, I'm going to give you opportunity for your last few words. Before then, just something I want to say, connection to a program matters a lot, because residency program are not just selecting applicant, they're not just selecting application, right? There's people in the program are selecting colleagues, right? Sometimes applicants stand out, for several reasons, not because of their score, because oftentimes people say, "Oh, I've scored so much. I've done, everything is perfect." But these programs are looking for people who probably understand their culture, feel familiar to them, because you don't want to work with a stranger that you don't even know his history, right? Programs are looking for people who are connected to them, who, their interest is genuinely aligned, with their culture. That's what I think. Dr. Tobe, your closing thoughts, and then we're going to stop the recording and then go into questions that probably will be more individualized on how we can maximize this talk today from the audience.
Yeah, no, so I think being intentional about putting your application together is very key. Um, keep in mind the timelines, keep in mind the steps, getting your LORs ready, getting your personal statements ready. I think having a theme or an idea of how you want to portray yourself will help, the way you highlight the different aspects of the entire ERAS application process. So yeah, I wish everybody the best, and
Thank you
and
so
good luck.
much. This is again a Global Research Initiative. We have a guest speaker today, Dr. Okobi, who is also my personal brother. Um, and we are talking on aspects on how to maximize your application. We'll be having this series of talk going on, almost every Sunday or almost every other Sunday. We will be ending today's session. You can find us on Facebook, IMG Research Academy. I posted it here. Please, we need everybody to search for us if you can and subscribe to what we're saying. And most importantly, not just about subscribe, we need you to make comments. So, keep it interactive. Let us know what else you want us to discuss. Let us know what else you want us to say. If you have an opinion or you have a better way of approaching these topics, let's do it so that we can all collaborate together to see ourselves effectively providing evidence-based care to our patients in the US and Canada. Thank you, everyone. This is Dr. Okobi again signing out. Thank you.